Good afternoon, good morning, wherever you are in the world. It's morning here for me in Taiwan. And so, welcome to another episode of QRA Live with me, your host, Jimmy, the Acu Sensei. And let me get the chat up so I can see when you enter into the chat, live chat. I've got that. Great. Okay, we are ready to go. And so, those of you new to the QRA Live, this is where you can ask any questions about any health condition. I would say, in my experience and also my team's experience, we deal mostly with chronic health conditions. Chronic health conditions are disorders that, have developed over years. It's also with, technical definition is 6 months or more. So if you are struggling with a chronic health condition, and maybe you have some symptoms, right? Let's say you have some pain. If you do, I could show you some QRA on this QRA Live. That's why it's called QRA Live. QRA is quick restorative acupressure. I can show you some QRA Live here, or I can go over maybe you've gone to many practice physicians and you have, you're not getting the results that you want, then hey, then maybe you need to find another practitioner. But where do you look, right? Yes, you could go on ChatGPT, you can go on Google, but you're not sure, because you're not sure if ChatGPT is accurate. So yes, you can type into the chat and I will go over the process of how, if you were a patient at our clinic, and these are the things that I would do. Okay. I do need to give a disclaimer. I am not a physician. I am not trained to prescribe medication or do surgery. And so everything that I suggest is just what I have done. What I have done with our patients in our clinic for the past, what is that? How many years? The past 18 years. My clinic, my team, they are the #1 rated acupuncture clinic and wellness clinic in the entire US. We have 760 5-star Google reviews. And so that's the background. This is just information. These are the things I need to say. Otherwise, YouTube, Google will shut me down. Okay. All right. So we already have people commenting. So the first person, this is first come, first serve. You comment into the comments, and I will go over the first people who comment. And Joanna, welcome again. It should be your afternoon or evening. Yeah, afternoon. Let's see. Performs muscle pain or SI. Piriformis. I think you're trying to say piriformis or sciatic. This is for my sister. Okay, yeah, piriformis or sciatica, right? Sciatica is not always due to piriformis syndrome. And so the piriformis, I'll break this down. The piriformis muscle is a small muscle that is connected to your leg bone, okay, to your tailbone. And it's a small muscle, right? But the sciatic nerve goes from your tailbone. If this is my tailbone, I have nerves going down my leg, right? And let's say this is my tailbone, this is my hip bone. There's a muscle connected between this and this, okay? The sciatic nerve comes down like this. It comes from a group of nerves and it forms into one nerve and it comes down the leg. That nerve, the sciatic nerve, basically runs by the piriformis. And yes, this tiny muscle. If the tiny muscle is inflamed, then yes, it could press on the sciatic nerve, causing sciatic pain. Okay. That is common. Another more common cause is actually from the spine. If there is inflammation on the spine, because the piriformis is not just the nerves are not just the sciatic nerve does not form just from the nerves coming out from the tailbone. You have these lumbar that are above, right? The above here. And so the L5, L4, L3. Typically, what I see with sciatica is those nerves in the L5, L4, L3 area, those are the ones, those spines are compressed and they are pushing. Either the disc is popping out or the disc is inflamed and it's pushing on, it's creating inflammation along the nerves that create the sciatic nerve. That's what we typically see in our clinic. But we have also treated piriformis, all of them effectively. Okay. So if the piriformis is, if the sciatic problem is coming from the sacral bone or your tailbone, right? So I just said the hand is the sacrum, right? So the hand is the sacrum. So what I would do with your sister is I would just start, if you live near her, or if she can do this herself, because the sacrum, right? If I'm going like this, sacrum, lower back. Okay, lower back is here, right? And so really your belly button is right here in the elbow, right? So from here to here is your lower back and then your tailbone, right? Actually, when you reverse it like this, it almost looks like a tailbone, right? So it's in your hands. So I would start with the sides of the hand. Sides, I would press, like I said, if you're in the same city as if you live near your sister, just have like hand massage. Recently I've been doing some foot massage, reflexology, but you can do hand reflexology as well. So you just want to massage the side of her hands first, and then you can go into every finger, right? I would go into every finger. I would pinch. Because remember, it's a bone problem. So you want to push on the bone, right? I would go through every finger and just massage, and then have her induce the pain. So, oh, you lost her audio. Okay, sorry. Okay, awesome. So I'm gonna finish this up. So have her induce the pain. She can induce the pain usually by bending from one side or to the other or lifting a leg. Usually those things will irritate her sciatic nerve. And you can have her lay flat on the bed and lift her leg up, right? If she lifts her leg up, sometimes those will also irritate her sciatic nerve. So do all those things and then massage her. Okay, massage from the side first, right? Pinch on the side of the pinky, pinch on the side of the pinky first, pinch on the side of the index finger, all right, index finger, pinch on the side, on the bone, right? And then go down, and then have her induce the sciatic nerve pain again. See if that decreases. If it doesn't, you can also go down here. Here's a bone right here, some second metacarpal, right? Go down here and press all the way down to the wrist. Okay, this is all. And because remember, I said sciatica can also come from L2, your lower lumbar, right? L2, L3, L4, L5. That's this area right here. If this is the tailbone, this is L5, L4, L3, L2, L1, all the way L1, right? Right. So you can go all the way here. You can press along the ulnar bone. Okay. You have two bones on your arm. One is for your right radial bone. This is your ulnar bone. So you can press on the bone and find that tender spot and then dig in, massage for 10 seconds, and then have her move, bend again to see if that sciatica decreases. Okay. If it does, then you got the right place, right? Dig in some more and then have her move again, right? Do one arm. If that doesn't work, do the other arm, right? And yes, the hand addresses the tailbone source. So actually, this could help you tell you where's the source, right? Without getting an MRI, which I'm not saying you shouldn't, your sister should, but this is one way. This is the beauty of QRA. This is not acupressure. This is QRA. If you do this, if you're massaging her hand and the sciatic pain decreases, chances are the source of the problem could be from her tailbone, a high chance, right? But if you go down here, the arm, and it reduces it, then it's probably in the lumbar, okay? So give that a try and let me know, report back next week. Or if she's, here, let me know if she can do it. if it's working. All right, awesome. Next, Laura, thank you for joining again. Occasional ear pain and allergies. Okay, allergies. So yeah, allergy season is coming, especially in Texas. In Texas, allergy season starts in cedar. The worst allergy is cedar to December, January, February, cedar season, right? So allergies, you feel the symptoms up here, right? But the cause is not up here. The cause is actually in your gut, in your intestines, right? So I'm going to teach you some QRA. Laura, I'll teach you some QRA first for your symptoms, but it doesn't solve the problem. Okay, these are for your symptoms because the symptoms are up here, but the problem is in your intestines, is your immune system, right? So if you are, and I think someone had, tennis elbow, Steph had tennis elbow. Okay, so I can hit two birds with one stone, right? I love using the hands here, so I'm gonna continue to use the hands. If you have allergy symptoms, okay, your hand also is your head. See? Your hand is your head. See? So this is your neck, right? This is your neck. This is your neck. This is your thoracic, right? Belly button right here is always in your elbow. Okay. So if this is your hand, let's say you have, usually you have your nose, itchy eyes, runny nose. So look at this. If I go like this, where at what level does my eyes and my nose cover, right? It's between right here and here, right? Typically, eyes are around these knuckles. So I would go above and below the knuckles, okay? Since your eyes itching, the eyes are soft. They're a soft, right? They're a soft part. They're not a hard part. We're not treating bone. So you want to go to the soft part of your knuckles, not your knuckles, the soft part. So the soft part is above here and then down here in between the bones, right? I would go to here and massage and find the most tender spot. And that when you find that tender spot, then you would press even on the side here. This muscle, you got a lot of muscle, soft, gooey part, okay? That goes to your eyeballs and then also your nose. Your nose is soft too, right? So you want to find the soft areas, press on those, and find. This is typically a pretty soft, tender area for most people. You want to press on it and then hold it. Okay. Now this will work faster with itchiness, like nose itchy, eyes itchy. It works faster. Runny nose, it doesn't. It works a little slower. If you have clogged, if your nose is stuffed up, this can work pretty quick too, right? If you find the right point. So push on the soft areas, right? So soft areas here, soft areas here, soft areas here, all of these soft areas, okay? And then if this hand doesn't work, you got this hand, okay? All right. So that's one way. And coming back to, well, I'll just finish this one. Now, allergies, you can hit two birds with one stone. So this nerve along this index finger, on the side of the index finger, okay, is connected to your large intestine, which is part of your immune system. Most importantly, and then the side of this pinky nerve is connected to your small intestine. So the immune system is balanced a lot in your intestines. So if you can stimulate the blood to your intestines, you can help treat the root cause, okay, one of the root cause to your allergies, which is which is a bacteria imbalance. The reason why we get allergies, okay, is because normally in our intestines, our small intestines and our large intestine, we should have a correct balance of bacteria. Now, we have tons of bacteria in our intestines. We have what's called good bacteria, and then we have what's called bad bacteria. The proper balance is not this. Good bacteria is here, bad bacteria is here. This is not balance. This causes allergies, okay? What's a proper balance of your bacteria in your intestines is this. Good bacteria should always be higher versus your bad bacteria. Why? Because the good bacteria helps keep this bad bacteria from overgrowing. It keeps it in check. This is balance. So a lot of times when we have allergies is because the bad bacteria becomes here. But then you need to ask, where is the why is that happening? Well, it's coming from your diet. Okay, so allergies comes from a lot from our diet. So if you're eating the wrong things, you're going to have allergies. Now, if you think, oh man, I can just take some antihistamine, over-the-counter antihistamine, yes, you can. You can do that for years. And I guarantee you, this is what we see in our clinic. People who have allergies for years and they take antihistamines, they never solve the root cause. So really the main root cause is what you put in your mouth. You're eating the wrong diet, right? That's the main root cause. You fix that, you will fix your allergies. But coming back to people, the patients that we have seen, okay, this is not some research done on PubMed. This is clinical research. This is real patients, in our paying real money. It's not free treatments. Okay, so uh, the people who have had allergies for years tend to develop autoimmune conditions. Why? Because allergies is an immune system problem. It is your immune system overacting to pollen outside when it shouldn't, right? And if you don't solve that problem and you just keep on masking it with medication, with antihistamines, with Flonase, with pumps, sprays into your nose, you keep doing that, eventually there's a high chance, super high chance, you will develop an autoimmune condition, right? Most common ones we've seen are Hashimoto's, autoimmune to your thyroid, right? So if you have if someone in your family has an autoimmune, you need to tell them, hey, just start fixing their immune system, right? Balance your immune system. Start with the gut. Okay. I think that's all for allergies. Yeah, I only got a few more minutes, so I'm gonna see if I can get everybody's. Steph, tennis elbow. Tennis elbow. Tennis elbow is what's happening is the reason why you have pain, and it's usually the tennis elbow is usually it's these tendons right here, these tendons, right, that are connecting your muscle to your bone, right? And they're these small tendons. Why do you get tennis elbow? One is common. There's a reason why they call it tennis elbow. It's when you play too much tennis, right? I play tennis, so I mean, it's kind of funny. Yes, you can play too much tennis and it can cause tennis elbow. But there's other people, it's repetitive work, repetitive use, right? And here's the main root cause: weak muscles. Weak muscles first, then repetitive use second, gives you tennis elbow, right? So you have to understand that in order to fix it. I'm going to show you some QRA to temporarily reduce the pain, but to fix it, you got to remember, I said number one was weak muscle. So weak muscle where? Biceps, weak muscle, and then also your brachialis muscle here, right? So one thing that you can do, let me show you QRA first, and then I'll show you what you can do to fix the problem. QRA, you're going to go to your fingers. So tendonitis or tennis elbow is called tendonitis. It's a tendon issue, right? You're going to go and it's a joint tendon issue. Look at all these joints you have in these fingers, right? See? So you're going to go to every single joint, first joint at a time, right? And you're going to press on, guess you have tendons here. Tendons are what allow you to move and control your finger. You're going to press on the side, all these tendons, right? And the joint, because it's the pain that you feel is near the joint. It's usually right here, right here, right here, right here, right? And even right here. These are the areas where you feel the pain. So this is if this is your elbow joint, you're going to press along the joint, right? In between all the way, right? You got 10 fingers to find the right point, okay? So you're going to press on it, find the tender spot, press on it, right? And then, see if you can extend your arm to see if your elbow hurts. Another way to, this is how we treat when we treat people in our clinic with tennis elbow, we have them squeeze something hard because it's that squeezing motion, that squeezing action that engages this muscle, right? And it makes your tennis elbow hurt, right? Sometimes just extending it doesn't hurt, right? So getting something hard and squeezing it will make it hurt. So I would say squeeze it and then test it. So find the right point on your fingers. It could be any of these fingers, right? On the joints, right? And then pick up your bottle and squeeze it and see if it's better, right? This is what we do in our practice. And for QRA, quick restorative acupressure, when we find the right point and we put a little acupuncture pin into it, the pain instantly reduces. Okay. Now, that's symptom relief. That doesn't fix the problem. The QRA acupressure doesn't fix the problem, right? What did I say is the problem? The problem is weak muscles. So you have to go back to the gym, or you don't have to go back to the gym. You can get some weights, okay? Oh, you already did it and it's much better? Awesome. Great. Thank you. Thank you, Steph. Now let's fix it, okay? Let's make sure it doesn't come back. So to fix it takes some time because you got to build muscle. Remember, the original problem is weak muscles. In reality, these big muscles are, when you're doing some type of repetitive motion, these muscles in your forearm, the muscles in your biceps, they're supposed to bear the stress. But because these muscles are weak, the stress, instead of going to this big muscle, it goes to these small tendons. That's how tendonitis occurs for any tendonitis. So you got to strengthen the muscles, right? And so, like I said, with squeezing the bottle, you have those stress balls. So you can strengthen your brachialis muscle, right, by getting one of those stress balls, right, and squeezing it. So you can start with a stress ball, really light, so it won't be too, it won't hurt too much on your elbow. It won't cause too much stress. So just squeeze that. When you're working, just have a stress ball, right? Right? I mean, they're good. The stress balls are awesome. Someone's stressing you out, just squeeze it in front of their face. Okay. Don't say anything. Just squeeze it in front of their face. Okay. Letting them know they're stressing you out. Right. But that will strengthen the brachialis muscle. And of course, the bicep muscle, you just need to you can buy some handhold weights, or you can get a gallon of water, right? And just raise them. Right. But you need to do it every single day. Okay. You want to get a low amount of weights, and you want to be able to do it 20 times, right? If you can't do it 20 times, the weight's too heavy. Okay, this is key. So you do this for a month. You do it every day for 1 month, right? You will build muscle, right? And your tennis elbow will go away. Okay. I will try a ball. Will strength training. Yes, that's strength training. Resistance training, strength training. Yes. But here's the thing, Steph. Whatever you're doing in the gym, make sure you can do it 20 times, 20 reps. Okay. So let's say I'm curling, uh, right? I'm curling something. Let's say this is a dumbbell and I'm curling. Make sure you can curl it 20 times. If you can only curl it 10 times, you need to reduce the weight. Okay, it's too heavy. Okay, this is key. We're not trying to be a bodybuilder here. We're trying to get rid of your tennis elbow. All right, guys. Let's see if I have a few more minutes, 4 more minutes, and I'll do one more. Tish, can you do anything for chapped lips? Absolutely. Absolutely. Okay. Oh, I got Faith from Spain. Welcome from Spain. Awesome. So let's go back to Tish. Tish, welcome. For those of y'all who are new to the channel, make sure you're subscribed to the channel, okay? So that you know when I'm go live. I go live every Sunday, 5 p.m. Central Standard Time, or 6 a.m. Taiwan time. I'm in Taiwan. Okay. So last one, chapped lips. So chapped lips is you don't have enough blood flow to your lips. Okay. That's not the cause. Because the cause is what's preventing you from from your brain moving blood to your lips. Chapped lips, dry lips, right, is you're not moving enough blood and fluid to your lips, right? And so what can you do? Well, if I use, let's say I'm use my hand again, okay, because my hand is my hand is my face. So remember a while ago I did one for allergies, right? So these eyes, right? Where's my lips? Lips, lips, lips are right here. Lips are around my wrist. So what you're going to do is this is QRA, quick restorative acupressure. Okay. By stimulating, you're going to go around your wrist and you're going to find points that are sensitive. Okay. So lips are soft, right? So you want to find, guess what's soft? Oh, look at this. We got some soft muscle right here, right? So go to your palm and press around. You will find some tender areas. You got to press hard. See, I like to pinch it, right? Like this is sensitive for me. Pinch, right? Pinch it and hold it for 10 seconds, right? Actually, I would hold it for 30 seconds because the chapped lips are not going to instantly get filled. What you want to do is you want to increase moisture. Moisture. So if you push on these, right, and you start getting more saliva, it's working. Okay. Now, that doesn't mean the chapped lips are not going to instantly become non-chapped and super flowing with fluid, okay? But so the symptom that you will experience is you will start getting some more moisture into your mouth. If that works after you press on your QRA, it's working. You just do that area, okay? Obviously, you want to drink water while you're afterwards too. But press on this palm. If this palm doesn't work, you got this other palm, right? So remember the soft parts around near your wrist, around the area, even around here, right? Soft parts. This will stimulate blood, which brings fluid to your lips. Okay. So what about fixing it, right? There's many causes, but I'll teach you one of the main cause is what controls. In our clinic, we always think about what organ controls the function. So what organ is supposed to control the function of the lips to prevent them from getting chapped? In Chinese medicine, it is the spleen. Now, this will make no sense if you're a gung-ho anatomy and physiology person, like you only believe what's in an anatomy and physiology book, then this is not going to make sense to you. But in Chinese medicine, 3,000 years ago, they found out that the spleen controls the lips, right? So chances are you have a spleen function problem. The spleen, now this is not going to show the correct side because I think this is flipped, right? Yeah. So this is my right side. This is my right side, okay, which is the liver. This is my left side. The spleen is near your left side, right? So your spleen is right here. So what I'm going to do, I'm going to use my hand. So my spleen is right here. So I'm going to draw a line to my arm and see it goes about right here, about a little below my elbow, right? So I'm going to push around to find the most tender spots all around, and okay, all around my elbow. I'm going to push around and I'll find the tender spot and I'm going to dig on it, okay, for 30 seconds, right? 30 seconds. Again, same thing. I'm looking for more moisture into my mouth. And when I do have that, I have the right point. So I've taught you two QRA. One is addressed directly to the lips. This one moves blood to the spleen, right? So you want to increase blood circulation to your spleen so that your spleen can regain the function of controlling your lips. Now, this is not going to instantly heal your spleen, right? Because the root cause is going to be what you put in your mouth. Because your next question should be, what is damaging my spleen? Chances are, and correct me if I'm wrong, Tish, you are eating things that turn into sugar quickly. Okay. One thing is sugar. One thing is simple carbs, right? Because sugar damages the spleen. Okay. So you're probably eating some simple carbs, white rice, white bread, white potato, white noodle, crackers. What else? White sugar, of course, bread, all of these, right? Sugar. What else is there? Even fruit juice, sugar, right? You need to cut down all of these. These are what damages your spleen. Okay. So give that a try, report back. You'll probably need to do this for at least cut down sugar, no processed sugar, no simple carbs. Okay. You can eat complex carbs. You can eat complex carbs that are like vegetables. You want to eat those. And you can eat fruits as a whole fruit. Do not drink juice, fruit juice. Okay. So stay away from fruit juice, stay away from any type of processed sugar, added sugar, even like cane sugar. All of those, they are natural. Cane sugar is natural sugar, but still stay away from those. Those all damage the spleen. Cane sugar, agave, all of those, stay away from those. Milk, okay, you got maltose, uh, you got any candy, cakes, white rice, white bread, any bread, white potato, white noodles. Stay away from those for 2 weeks. Do my acupressure and see if your lips get more fluidy, less chapped, and plump up maybe. They might even plump up. All right. All right, guys. Thank you for attending. Gotta go. Again, get your friends, family to subscribe to our channel so that they know any updates. Sometimes I may have to change the time, but most of the time, Sundays, 5 p.m. Central Standard Time, 6 a.m. Taiwan time.